Welcome to Healthcare De Jure, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Healthcare De Jure is brought to you by High Tech Answers and HealthcareNOWradio, part of the Health IT Answers Network. The broadcast is sponsored by the law offices of Myrick O'Connell. And now here is your host, Matt Fisher.
Well, welcome back, and thank you for joining as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today are Nick Adkins, a digital healthcare evangelist, and Jamey Edwards, the CEO of Cloudbreak Health. Welcome, guys.
Thank you for having us.
Thank you, Matt.
Yeah, it's great to talk to you guys again. It's been a while since I think all of us were able to chat. I think it was probably back in March when we were all in Vegas.
That's right.
I believe so, yeah.
So before we dive in, in case people aren't familiar with either of you, could you just give the audience a little bit of a background in terms of who you are and what you're doing? And I guess I'll let Nick go first on that one.
Yeah, I'm Nick Adkins. I live in Portland, Oregon now. I moved here from Nashville 4.5 years ago and was fortunate enough to be one of the co-founders on a team here that created some really cool technology for telemedicine, specifically for asynchronous video use. And really happy that I get to meet some awesome people like you, Matt, and get to go to a lot of conferences and see some really cool technology. So I'm really grateful to the universe for that.
So how about you, Jamey?
Yeah, so my name is Jamey Edwards. I'm the CEO of Cloudbreak Health. Cloudbreak is a unified telemedicine platform that's in about 650 hospitals across the country. It links them over a private broadband network. It brings all your specialties together on one platform. And before Cloudbreak, I was the CEO of a company called Emergent Medical Associates, which was a ER hospitalist and anesthesia group in Southern California that we grew from 4 contracts to about 40 across the area, and saw about 1 million patients a year by the time that I left. And I still sit on the board of that organization. And prior to that, I was actually an investment banker and private equity guy. So I like to say I'm a recovering investment banker.
So what ended up drawing both of you into telemedicine? Because it sounds like, Nick, as you said, you had the Nashville background, which I think a lot of people know is kind of the hub for-profit healthcare, and then Jamey, it sounds like you were with kind of on the emergency side. So what brought both of you into telemedicine?
Yeah, so for me it was, I live in Oregon now. My mom lives in a little town back in Alabama, and we probably have all used Skype or FaceTime or Google Hangouts or some version of that to communicate with our friends and family. And it just only made sense to be able to communicate with my mom and her providers using telemedicine. I mean, it's I want to be part of her care and be on the same plan with her providers, what they want her to do. And when you're this far away, I mean, telemedicine, it's the only thing that makes sense. So for me, it was wanted to be expertly engaged with my mom's care.
Yeah, for me, it was working in the ER hospitals and anesthesia side. You realize how broken the system is. And when you realize how disconnected patients are from their providers, and the fact that we've actually made providers' lives so difficult and having to document in an EMR and cover their butts from a malpractice standpoint. And it's led to not only a physician shortage, but a lot of physician disenchantment. And so for me, what attracted me to telemedicine was the ability to use technology to actually build relationships as opposed to have it get in the way of breaking them down. So, the fact that you can actually see a patient in their home or bring a specialist in who previously that patient might not have had access to, that to me was what humanizing healthcare was all about, if you will. And creating, again, we were just on the ATA chat a little while ago, and being able to talk about how there are these human touch points that technology can facilitate. That was really attractive to me because you could do it on a very scalable basis, right? It wasn't like a one-off patient encounter. You could do this across the country for millions of patients. That's what attracted to me. It was a really big opportunity.
Yeah, it's an interesting point that you just raised, which is, or that I think both of you raised, which is talking about it's taking advantage of technology that we're seeing in other areas, and enhancing our ability to deliver healthcare. And actually, for maybe a little bit of a context, what time frames are we talking about that each of you got into the telemedicine area?
Oh, for me, it was probably early 13 or late mid 2013, when I came to it.
Yeah, for me it was 2008. I was actually sitting on as the CEO of Emergent Medical Associates, and we took a look at a company called the Language Access Network, which is now part of Cloudbreak. And Language Access Network provided video remote interpretation services to hospitals, and we actually made an investment in that organization, and that was my initial indoctrination into telemed. And ironically, that company was founded back in 2003 and was one of the initial telemedicine pioneers.
So, and actually, maybe this is more for you to take on first, Jamey. So, how have you seen telemedicine evolve over that time period?
Yeah, so when you take a look at its evolution, telemedicine 1.0 was pick up the phone, call your doc. And telemedicine 2.0 was we're going to add video to that encounter because 70% of communication is nonverbal, and being able to see your physician or be able to point to where it hurts, really brought a lot of value to the encounter. But now we're in telemedicine 3.0, and telemedicine 3.0, for as we define it as a company and as part of our mission, is open platforms and allowing hospitals to all collaborate on the same system. So it's not about these closed-in systems anymore that don't play well with others. It's about interoperability and being able to bring all of the resources to bear around a patient and a care team that you can, but do it on one platform.
So, and how about for you, Nick? How have you seen it evolve over the period of time that you've been involved?
Yeah, so what I've been seeing is, everybody's got a phone right now, right? Whether it's an iPhone or an Android, we've all got these really smart things in our pocket. And so people are starting to realize, you really don't have to go buy a robot. You don't have to put a lot of capital and investment and infrastructure into having the ability to communicate with your provider using telehealth. We've all got this mechanism that allows that. And so, Matt, you and I, we routinely talk a lot about HIPAA and how that kind of stands in the way a lot of times for innovation. And I think what we're seeing with companies like Jamey's, that are providing secure end-to-end points for telemedicine. And let me throw a little disclaimer in here real quick. I love Jamey and Cloudbreak and the whole team. I'm on their advisory board, so I don't want to not say that. So I love them, but I'm also kind of biased. But what's going to happen here, in the very near term, I think, is we're going to see a lot of consolidation in the market. There's going to be this migration to certain key ecosystems that provide a complete ecosystem of telehealth services and solutions like Cloudbreak and some others. And I routinely get back to this piece of we need more consumer awareness. We've got the technology. The technology exists today. It's already being used in all kinds of places. I mean, that last thing that Kaiser ran last month. Last year, they did 110 million visits, 110 patient-provider encounters last year. 52% of those were done virtually, right? And when a lot of times people around the country think, oh, Kaiser, that's just a system that's out in California. No, it's not. It's in Oregon, it's in Washington, it's in some of the mid-Atlantic states, it's in Georgia. I mean, so this is a health system that's got a very large national footprint, and they're showing you, look, this is already happening today. But the problem is, a lot of consumers, a lot of us, aren't even aware that it's available. So the mission right now for everyone is to get out there and say, look, this exists today. This isn't something in the future that's going to happen when Star Trek's around. It's already happening.
Yeah, I think that's a great point. And the one thing I would add to that is, as it's evolved, we've seen it evolve from a cool technology to something that's now just integrated into how care is delivered. And that, to us, is the secret of making this really work, because when you implement a new technology platform like a telemedicine platform, it needs to be easy to use and accessible. And the platforms are now all of those things. And so when you're asking a doctor to change their practice pattern, you're actually trying to affect culture change. And to Nick's point, you need to provide education and support and let people know it's out there. And that's probably where we are on the curve, is that the technology's caught up, right? Not difficult to make a video call today. A lot of the workflows around that and everything else are proprietary to some of the companies who are, employing it in the space. But it's really about now making it part of the culture and saying that this is an accepted way of producing care and that it provides a lot of value. And not only Kaiser, but the VA is another huge user of telemedicine. They have studies out that show how much money they've actually saved in implementing it, how quality is improved. And it's interesting that a lot of the closed systems from an innovation standpoint are actually driving it forward and saying this is how we're going to do it. It's in, you've got Kaiser doing it. Well, they can do it because they control the money and the patients. Same thing with the VA. It'll be interesting to see how we can proliferate that where you've got disparate entities who are trying to figure out how to deliver systems of care.
Yeah, I think that there's a number of interesting points that both of you just raised in there. The one being from the use standpoint, the fact that it's becoming seamless, so you don't have to think about it. It's just something that's a readily available tool, and I think as both of you are saying, that's what will help to drive the culture change. Because if you don't have to think about it, then it's much easier to utilize it. But the other piece, which I think is interesting that you just raised, Jamey, and was kind of building off what Nick said, is Kaiser and the VA are closed systems, so they arguably have more control over what occurs within it. What do you guys see as the challenge to get the open systems to be more frequent users of these tools? And kind of maybe adding a second question onto that is it better to go incrementally? So I know a lot of times teleneurology or tele-ICU, those types of uses are used to get people used to a telemedicine or telehealth solution. So is it better to start in those areas, or should we go into, force people to jump in whole hog and really try and get to the more robust use that is available for all areas now?
Well, one of the early pushbacks, and arguments was, I'm not going to get reimbursed for this. And so big hat tip to the American Telemedicine Association and people like you and Nathaniel Lackman at Foley and all the other people who've done some great lobbying for reimbursement parity. That's not an argument anymore. I mean, CMS covers Medicare, Medicaid, covers telemedicine. And what's the number up to now? I mean, 30 states have reimbursement parity right now, I think, roughly. For third-party providers, so that's not an issue. I routinely say, what if it wasn't about the money? What if it was just about the art of medicine and you're taking care of your patients, right? But sometimes that's a little too, unicorn type thinking. But why not? This is a way for patients and providers to access each other, to bring care to where the patient is. A big hat tip to United, one of the payers, in California. They, in 2015, implemented telemedicine for all their members. And they did a really nice marketing push and to let their membership know that if you want to stay home in your jammy pants, it's covered. Okay, we'll pay for this. And here are 3 different vendors you can select. That's the way it's going to roll across the country. It's just consumer awareness hasn't caught up with technology, like Jamey said earlier.
Yeah, just to kind of double down on what Nick is saying a little bit. From a regulatory standpoint, there are still issues from a structural standpoint, right? There are these structural obstacles to telemedicine's proliferation, and one of those is around licensing and credentialing of physicians, right? That's normally handled at the state level, and now we're seeing these licensing compacts kind of fit together so that doctors can be licensed in multiple states more easily, and then you've actually got credentialing at facilities for where you're doing the e-consult model and you're sharing specialists. So there are those types of structural regulatory obstacles. You guys brought up HIPAA before. It's definitely getting in the way. I think patients are really willing to trade some privacy for access, right? And so that to me is something that, when HIPAA's in the way, you're saying, well, you have to be able to sign a business associates agreement. That is a relatively high bar to be able to do. And a lot of companies are simply unwilling to do it because they don't want to take on the risk associated with it. So those types of obstacles remain. And then obviously payment. I was literally in a meeting yesterday with a healthcare plan, and they said, but how are we going to get paid for it? And I said, well, the issue isn't necessarily what you're going to get paid for. You have to define what that means, because there's a ton of avoidable costs and improvements in quality that come as a result of using telemedicine. So is there a direct payment for it? No. But is there a huge ROI on it? Yes. So it's just the market is still being educated around these types of things. And then from a patient standpoint, a lot of people aren't going to the people and be like, oh my God, I just used this amazing telemedicine product and it made my total life easier. It's just, it's not something that you normally talk about with your friends or at the dinner table. And so when you're affecting culture change, those types of symbolic pushes really help. And Teladoc is obviously making a lot of headway. Doctors on Demand is making a lot of headway. A lot of employer groups, that are using MD Live and American Well are making a lot of headway. But what they'll do is they'll roll out the platform, and then they won't educate their patient base or the employer base on how it should be used and spend a lot of time doing that. And so it's there, but it's not being used a lot. And so it goes back to, again, education, culture change, and just making it an accepted part of the medical platform.
Yeah, no, I think the education and just driving change are clearly going to be key components to it. If you, as you both are saying, if you can get people comfortable with something, they're more likely to use it, and if you make people aware of it, they're more likely to use it. So, I mean, it sounds like to some degree those are going to be one of the bigger hurdles. But to just put it out on the table, what do you see as the biggest hurdle to the use of telemedicine right now, and what can be done to help remove that hurdle? Or hurdles, if there's complementary ones?
Yeah, I would say it's existing culture in a lot of organizations that's standing in the way. And, that's culture shift takes a while sometimes, unfortunately. So, but that shift is inevitable, and it's happening.
Yeah, so to support that, we have been in telemedicine now for 13 years, right? And one of the things that we did 8 years ago was we started putting what we call client advocates into the field. Because what we noticed was we'd go and we'd install the platform and we'd do our trainings, and there'd be all this usage, and then it would slowly, over time, people would revert back to their mean behavior. And what you need to do is offer them support and reminders, and you have to change the mean behavior to actually include a platform like this. So it's absolutely cultural. Look, at the end of the day, we're all people, and it's human behavior that drives the use of any technology. And it's about changing that behavior for the better and showing people that this is a better mousetrap and in a better way. And that's one of the keys.
Yeah, and kind of the focus on culture, I think, is a nice way to be able to ask you guys about a more popular movement that I'd say is probably an on-the-ground type movement that I think a lot of people might recognize you from, probably Nick foremost, which is the Pinksocks movement. So just kind of wondering, one, I'd like you guys to be able to help explain that to everybody, because I think a lot of people who've been at any type of a healthcare IT or healthcare conference over the past couple of years have probably seen these socks popping up, but I know there is a much larger meaning and message behind it. So I'd like to help ensure that everyone actually understands what we're talking about.
Yeah, so the Pinksocks tribe, that is really just kind of an awesome, unexpected phenomenon. A couple of years ago, a friend of mine, Andrew Richards, is co-founder of this company here in Portland. He and I went to HIMSS in Chicago that year, and I wear a kilt every day, and when you wear a kilt, you have to wear fun socks. And people were routinely coming up to me asking me where I get my socks, and I thought, wow, what a great icebreaker, conversation starter. So before we go to HIMSS, Andrew, I'm going to get a bunch of these pink socks, which seem to be the crowd favorites, and we'll stuff them in our bag. And every time somebody comes up, we'll give them some socks and start a conversation. And so one of the first people at HIMSS that year that came up was Dr. Topol, Eric Topol. And, I gave him these socks, took a picture and tweeted it, and looked back down at my phone a few seconds later, and he had retweeted it. And the next thing I knew, that it had kind of gone viral at HIMSS. And we just, I kept giving away socks at every conference I went to. And it just, for me, it was about having a connection with someone, meeting new people. You can stand in a room and somebody will come up to you and say, hey, what's the story on those socks? Great. That's an opportunity for you to share space with someone that had you not been wearing the socks that day, the two of you would have missed each other in the universe. And that's sad, because what we're here to do is to connect with each other. So I routinely tell people that get the socks, when that happens, when somebody asks you about your socks, that's your cue to, stay on the bus and another stop, stay on the train and another stop, get off your bike, close your phone, do whatever you need to do to just look at that person in the eye, introduce yourself, and share space with someone new that day. And so what do they mean? I don't know. That's what they mean from me. Some people say, it's about patient engagement, patient experience, disrupting healthcare from the ground up. I say yes to all of that. Whatever it needs to mean for each person is what it means. But for me, it's never about anything other than, wow, it was really awesome to connect with you and see you and share space.
Yeah, it's really interesting. I had seen Nick walking around some conferences prior to really meeting him and sitting down with him. We were at Exponential Medicine 2 years ago. And, you see Nick is a very notable guy at a conference, right? The beard, the hat, and the kilt and the socks. And you're like, I got to meet that guy. I want to know what he's doing. And you walk up and you meet him, and there's just this aura of kind of acceptance and connection that happens when you talk to him. And when he gave me my pink socks, it was the start of this journey for me. And in healthcare, right, you get beaten down every day with why things don't happen, right? And you get a little bit jaded. You might have a great idea and a great innovation, and everyone surrounding you will telling you why it's never going to work, right? But what Pink Socks started for me was the opposite of that. It's like, well, why wouldn't it work? And I used the initial Pink Socks to get on Twitter, and I've used Twitter now to meet a whole slew of other people, including you, Matt, right? Through that network, and it's just opened me up to what the possibilities are. And for me, it's about innovation and disruption and connection. And you see people who are wearing these socks around conferences, and you're like, all right, that person's interested in trying to affect some change. It's not just about the socks anymore. It's about this being a part of something bigger than yourself and trying to have a positive impact in whatever you do. And whether that's healthcare or life or whatever it is, that's what Pink Socks has evolved in. For me, has really been the connectivity, and I've made some incredible real life relationships out of Pink Socks and then what's happened on Twitter as a result of Pink Socks.
Yeah, no, I think that.
And Matt.
Oh yeah, go ahead.
Literally, yeah. I mean, it's just awesome. The amazing people that I've been able to meet online and in real life, and the real life connections are really fantastic. That's really the reason I go to a conference, is to meet people in real life. But there are literally thousands of Pink Sock tribe members around the world at this point, and it's just, it's every day. I'm sending out some socks to somebody around the world, and I'm getting on Twitter every morning and searching the hashtag Pink Socks and seeing where the tribe is, and we're trying to celebrate each other's moments every day, and it's just, it's a lot of fun. And
the one thing
it's like when Jamie says, there's so much out there that there's so many people that can beat that drum that's, says why it's not going to work, why everything's broken. How about let's look at what is working. Let's look at all the good in the world. And so, one of the things I routinely say about the Pink Socks tribe members is we're a bunch of people that, we see all the good in the world. And when you believe that, you see it. And so there's a lot of people that believe that, there's a lot of good stuff happening right now, and they see it and they want to celebrate and be a part of that. So I'm very grateful to the universe just to be a part of it.
And the one thing that I'll add is just, the symbol that something's become something bigger in a movement is when Nick's not the guy sending them out, right? So Bear is now sending out Pink Socks to people, right? There are people all over who have now went out and bought their own Pink Socks to extend this gift forward. We do it as a company. If people who are watching this want Pink Socks, they can get them from either Nick or I. It's just like this little piece of goodness that you're handing to someone and saying, hey, have a great day. Hope this makes you happy. Please pass it on, right?
It's both you're saying. It's all
health
about the
systems. There are health systems that are out there getting socks, on their own. There are groups in Europe that I've been watching. I'm like, wow, I don't even know these people, and it's so fun to watch it go. So.
Yeah, no, it's all part. I think it's probably taps into social media, the fact that you can create these communities and spread a network and share a connection a lot. It feels like a lot more easily than maybe in the past, since things can become a lot more immediate. And as both of you were saying, you can track it on a day-to-day basis. It's not relying upon running into people at a conference, but you can, from your house, be able to see what everyone else is doing and be able to reach out and be able to keep that connection going. So it's not just, like maybe a once a year thing, but it's like, the three of us will interact on Twitter probably on a daily basis, and then we can set things like this up. So it's a way of fostering that community and ensuring that we're keeping a dialogue going. And, I think that's where you can really spur the change.
Right, which now, by the
Absolutely.
way, given the election, is a really important dialogue, right? Like, I just got emailed an inquiry from a magazine saying, well, what now, right? What's the future of healthcare under our new president-elect? And, the Pinksocks community is going to have a say in the direction this all takes, right? And it's going to happen on Twitter, and people are going to be sharing ideas on social media. That's really the neat thing about it, right?
Yeah, well, so I'm actually going to steal that question that you just raised, because we are starting to get very close to the end of our time. So what do both of you guys think is coming in the future for healthcare?
Change. Definitely.
Yeah, you know, what I would tell you is that right now we're sitting on a lot of uncertainty, right? President Obama spent a lot of time architecting Obamacare and getting it pushed through. It was his labor of love to a certain degree. And by the way, there's things about it that work and a lot of things that don't, right? Well, we now have the opportunity, and I think when we took a look at, you know, Trump as a president, Hillary as a president, you know, Donald's healthcare plan wasn't so illicitly laid out for us. We just knew that generally he wants to repeal the ACA, and that's the path he's going to go down. Well, that's going to have a definite impact on folks, and it's up to us as healthcare leaders now to kind of track and trend, keep track of the regulations, and try and feel the pulse of where things are going to make sure that we stay ahead of it. But right now, for me, it's a lot of uncertainty, and that's not necessarily a bad thing, because a lot of the change might happen is, you know, change for the better, but only time will tell, and it's going to be up to all of us as healthcare leaders to remain engaged and be able to hold these elected leaders accountable for, at the end of the day, the U.S. that we have to live in.
Yeah, no, I think as both of you are saying, there's certainly going to be change on the table, and that presents an opportunity for, you know, as Jamey said, for all of us who are engaged within the industry. But you know, believe it or not, we're out of time already. This, you know, this conversation has certainly flown by, and you know, it'd be great to have you guys back on in a few months. But I definitely want to thank both of you, Nick and Jamey, for being on the show today.
Again,
thank you, Matt.
This has been great, and yeah, we could clearly talk about this for a few hours. So thank you for the opportunity.
Yeah, no, and thank you to everyone.
It's probably good you cut me off, Matt, because I was about to jump in on the Affordable Care Act and rip on that for about 5 minutes.
Yeah, so, well, thank you to everyone out there for listening.
There's 22 million people that came into the system, right, because of the Affordable Care Act that need coverage, that have coverage now. Those 22 million of our fellow citizens, they're not going to vanish. They're not going to go away. So we still have to come up with an answer for how we're going to take care of each other, because we're all in this thing together. That's what we got to remember.
Yes, no, that is a great message to end on, that we are all in this together. So thank you everyone out there for listening. Keep the dialogue going and connect with me at #HCDEJURE on Twitter, and you can find Nick and Jamey there as well. I'm Matt Fisher. Until next time.